So one of the other motions that is really important to define is lumbar pelvic dissociation. And this is simply the ability to discern hip flexion from lumbar flexion. This is the motion that we talked about that our athletes, especially our female athletes, especially our soccer athletes, have a really hard time doing. And if we can teach them to have or discern that lumbar motion from hip motion and have that that controlled stability or that controlled mobility of the hip on a stable lower kinetic chain, they're going to reduce their risk greatly. So the motion is simply the ability to discern hip flexion versus lumbar flexion. Lumbar flexion, hip flexion. And that's really important to discern those two, because that ability to discern that small area of difference between lumbar motion and hip motion is critical. Now, one of the other motions that we talked about was femoral internal or external rotation versus hip internal and external rotation. So, and I know in movement, sometimes those two are very hard to discern. But what we want is we don't want femoral internal rotation. What we want is stable femur and hip internal and external rotation. So what I would encourage you to do is to pause the video at this moment and try both of those things. And try them in front of a mirror, because the discerning that hip motion from lumbar motion is critical, and also discerning that femoral motion from hip motion. And simply in a stride stance, keeping a stable femur and driving your hip down in a diagonal pattern. This is a really good exercise, close kinetic chain exercise for the glute medius, and we'll talk about that a little bit later.